They won't tell you this, but I will. And if you're over 60, you need to hear this more than ever. Have you quietly stopped touching yourself in recent years, thinking, well, that part of life is behind me? If so, I need you to hear this from me, not in judgment, but in care. I'm Dr. Jonathan Prescott. I've worked with older men for over 35 years, men who've raised families, built careers, endured losses, and now face something no one warned them about: how silent aging can be, and how dangerous it becomes when we ignore the most private parts of ourselves. Let me be clear. If you stop masturbating, or you're still doing it the same way you did at 30, your body may already be paying the price, quietly, gradually, and far beyond what you expect. Today, I'm gonna walk you through 7 common mistakes older men make when it comes to self-pleasure. Mistakes I see all the time in my practice. Some are physical, some are emotional. All of them matter. So, stay with me. This might just change the way you age, with more comfort, confidence, and clarity. Let's begin. Mistake 1. Believing in the semen retention myth. Let me tell you about Alan. He's 71, retired naval officer, strong handshake, proud posture. But when he sat across from me during our first appointment, he looked hesitant, almost embarrassed. I read online that if I don't ejaculate, I'll keep my testosterone high. More energy, better focus, better control. Is that true? It's not the first time I've heard this, and it won't be the last. The belief that holding in semen somehow transforms you into a sharper, stronger man has been floating around for centuries. Some even call it semen retention and treat it like a sacred health hack. But here's the thing, science just don't support it. A large study published in JAMA Urology followed over 30,000 men and found that those who ejaculated more frequently, at least 21 times a month, had a significantly lower risk of prostate cancer, especially as they aged. Another study looked at testosterone levels and found that while short-term abstinence might lead to a tiny temporary spike, it doesn't last and it doesn't improve your strength, mood, or masculinity in any meaningful or lasting way. Now, if you feel more focused when abstaining for a while, that's your experience, and I'll always respect that. But if you withholding from yourself out of fear, shame, or internet myths, you doing your body more harm than good. Your body makes semen continuously, not like a savings account that builds power the longer it sits. If you don't release it, it doesn't make you a superhero. It just gets reabsorbed. Or worse, leads to congestion, discomfort, or nighttime leakage. So here's my suggestion. If you enjoy self-pleasure and it feels good to you, don't hold back out of fear. Your health, your hormones, and your prostate might actually thank you. Mistake 2. Feeling shame or guilt about the act. Let me tell you about Harold, 72 years old, Vietnam veteran, widowed for over a decade. When he finally worked up the courage to bring up the topic during a routine checkup, he leaned in and said, "Doc, I still get the urge, but I feel like I shouldn't. I mean, isn't it just wrong at my age?" I looked him in the eye and said, "Harold, no, it's not wrong. It's human." You see, one of the most damaging mistakes older men make isn't physical, it's emotional. It's carrying decades of shame around something that's entirely natural. For some, it's rooted in religion. For others, in outdated cultural beliefs, like men shouldn't do that. It's childish, it's dirty. At your age, grow up.
But here's what science and experience say. Self-pleasure is a valid, healthy expression of your nervous system, your hormones, and your connection to your own body, even after 60, 70, or 90. And beyond the physical release, it's a mental and emotional pressure valve. It releases endorphins, boosts dopamine, and for many men, reduces anxiety, helps with sleep, and improves overall mood. In fact, the American Journal of Men's Health reports that older adults who engage in regular self-pleasure have better emotional well-being and cognitive confidence, especially those who live alone. Harold broke down in tears, not because of guilt, but because someone finally told him he wasn't broken. And maybe you need to hear the saying, so I'll say it to you now, clearly and kindly. There is no age limit on being human. There is no shame in honoring your own body, and you are not alone. Let that sink in.
Mistake 3, using the same grip and technique every time. Now let's talk about something most men never question, your technique. And I get it. If it's worked for decades, why change it? But here's the truth, friend. If you've been using the exact same grip, pressure, speed, and rhythm since the 80s, your body may have adapted in ways that are now working against you. It's something we doctors quietly call death grip syndrome. Yes, it's a real phenomenon. What happens is this. Over time, your brain and your nervous system become trained to respond to one very specific type of stimulation. That repeated pattern, the tight grip, the rapid pace, rewires your sensory response. So when you're with a partner, or even just trying to experience natural sensation, it can feel dull, unresponsive, or disconnected. I had a patient, Dennis, 68, who told me, "Doc, I thought I was broken. I couldn't feel anything unless I did it the old way. My wife thought I didn't want her anymore." He wasn't broken, he was stuck in a loop. And the solution wasn't a blue pill, it was neuroplasticity. The nervous system can retrain itself, but only if we give it new input. So here's what I suggest. Try switching hands. Change up the speed or pressure. Use your fingertips instead of your palm. Explore circular motions instead of linear ones. You don't have to reinvent the wheel, but you do have to give your body something new to respond to. Because what worked at 30 might actually be numbing you at 70. And remember, pleasure isn't just about getting to the finish line. It's about staying present, discovering new sensations, and keeping your mind and body engaged. Don't just repeat, relearn. Mistake 4, avoiding lubrication. Let's be honest here. Most men over 60 never think about lubrication. Why would they? It's not something we grew up talking about. In fact, some men even see it as a weakness, like needing extra help. But let me say this plainly, as your doctor and as someone who truly cares, avoiding lubrication after 60 is like driving on bald tires in the rain. Sooner or later, there's going to be damage. As we age, several things start to change. Testosterone drops, skin gets thinner, and natural moisture decreases. If you're taking medications like antihistamines, diuretics, or blood pressure pills, it gets even worse. And that dry friction, it's not just uncomfortable. It can cause micro tears in the skin, increase sensitivity loss, and sometimes even lead to inflammation or infection. I once treated a man who came in thinking he had a skin condition. Redness, burning, soreness. Turned out he'd been using no lubrication for years and had worn down the delicate skin through sheer repetition and dryness. He started using a simple, unscented, water-based lubricant, and within 2 weeks, his symptoms were gone. And he told me it changed everything. So here's my advice, simple and direct. Don't wait until it hurts. Don't feel embarrassed to walk into a drugstore or click add to cart online.
This isn't about luxury. It's about comfort, health, and respect for your body. Because at this stage in life, it's not about doing things the way you used to do them. It's about doing them better and smarter. And trust me, a little lubrication can go a long way towards protecting not just your skin, but your dignity and your pleasure.
Mistake 5. Ignoring the rest of your body. Here's a surprising truth that most older men never hear. Masturbation isn't just about what's between your legs. It's about your whole body. But too often, especially after 60, we treat it like a task. Quick, mechanical, focused only on one place. No emotion, no curiosity, just get it done. And in doing that, we miss out on something far more powerful, something that actually becomes more important as we age. You see, your body isn't responding the same way it did at 40. Blood flow slows, nerve sensitivity changes, muscles tighten differently. But here's the good news. When you involve more of your body, your brain responds with greater pleasure, circulation, and release. Let me give you an example. I once had a 75-year-old patient named Lewis. He'd lost some sensation and told me, "Doc, it feels distant, like my body's going through the motions, but I'm not really in it." I asked him to try something simple. Place a hand on his chest while breathing deeply. Use light touch on his thighs, neck, and abdomen before anything else. Let himself move freely, not stiff like a statue. 2 weeks later, he came back and said, "I didn't expect it, but I felt connected again, like it was me, not just my body." That's the power of shifting focus from just the genitals to your full sensory system. You stimulate more nerves, engage more blood vessels, and trigger more oxytocin. That's your bonding hormone, by the way. It's not just for romance, it's for inner peace. So my question for you is this: what parts of your body have you been ignoring? Because pleasure lives in more than one place, and the more you invite your body to the conversation, the louder it speaks. Mistake 6. Rushing through the experience. Let me ask you something. When was the last time you gave yourself time? Not 5 minutes squeezed between the news and bedtime. I mean actual unhurried space to slow down, breathe, feel. One of the most common mistakes I see, especially in older men, is treating masturbation like a quick chore instead of what it really can be, a moment of connection, release, and even healing. And I get it. Many of my patients, especially those living alone, say things like, "I just want to get it over with. I don't want to think about it too much. It feels silly to light candles when I'm the only one in the room." But let me tell you, rushing robs your body of its full capacity to feel. When you go too fast, you activate your sympathetic nervous system, the stress mode. Your muscles tighten, blood vessels constrict, and pleasure gets muted. But when you slow down, when you take your time, breathe deeper, let sensation build, you activate the parasympathetic nervous system. That's the one responsible for relaxation, erection maintenance, deeper climax, and yes, even better sleep afterward. I remember one man, Wallace, 69 years old. He told me, "Doc, I tried what you said. I put on music, dimmed the lights, took a warm shower first. It was the first time in years I didn't feel rushed, guilty, or numb. I felt human." That's the word that stuck with me, human. Because this isn't about performance, it's about presence. So next time, don't race to the finish line. Light a candle, turn off the harsh lights, breathe, touch, pause,
Let the experience unfold, not explode. You're not a machine. You're a man with a lifetime of experience. Treat your body like it deserves that respect.
Mistake 7. Ignoring tools and enhancements designed for men over 60. Here's a question most men don't expect from the doctor. Have you ever tried a sleeve, a ring, or a gentle stimulator just for yourself? Now don't get defensive. I'm not talking about toys in the way some might laugh at. I'm talking about medical-grade tools designed to support men just like you. The kind of men who say, "Doc, it takes longer these days. I don't feel things as strongly anymore. Sometimes I lose firmness midway through." Sound familiar? That's not failure. That's biology. After 60, changes in blood flow, nerve sensitivity, and hormone levels are normal. But ignoring them, that's where the real mistake happens. Let me tell you about a patient, Richard, 74, former engineer, precise, logical, skeptical. He never once considered using anything beyond his own hand. But when I introduced him to a simple, soft silicone sleeve designed to enhance sensation and reduce pressure on aging tissue, he gave it a shot. 2 months later, he came back and said, "Doc, I don't know why I waited so long. It made things feel alive again." There are devices out there today that support circulation, reduce grip strain, enhance nerve feedback, and even help train your pelvic floor for better bladder control and erectile function. And no, they're not just for the young or the kinky. They're for the smart, the men who adapt, the men who want to age with agency, not shame. Think about it like this. You wear reading glasses, right? You might use a hearing aid, a cane, a CPAP machine. Not because you're weak, but because you're wise. Your sexual health deserves the same level of care. It's not giving up, it's stepping up. So if you've never explored what's available for men your age, maybe it's time. New mindset and a complete approach to self-pleasure. So now that we've gone through these 7 mistakes, let me ask you a deeper question. What if everything you thought about self-pleasure after 60 needs to change? Not because it's wrong, but because it's outdated. Too many men treat this part of life as something they should outgrow, like it's some leftover habit from youth, something to hide or be embarrassed about. But I want to offer you a different lens. What if self-pleasure is not about release, but about relationship? Not with someone else, but with yourself. I've worked with thousands of men over the years, and here's what I've seen. The ones who thrive, not just physically, but emotionally, are the ones who stay connected to their bodies with curiosity and compassion, not judgment and shame. They explore new sensations. They listen when something feels different. They slow down. They adapt. They evolve. It becomes less about performance and more about presence. Less about fantasy, more about feeling alive. And guess what? Science backs this up. A 2019 study in the Journal of Sexual Medicine found that older adults who engaged in mindful, regular self-touch with intention and care had better mood, decreased loneliness, improved immune markers, and even reduced blood pressure. Yes, your heart benefits when you reconnect with your body. So if you're watching this right now and thinking, maybe it's time I stop avoiding this conversation with myself, you're right. It is time. And no, you don't need to be perfect. You don't need to do it like you did at 30. You just need to do it with kindness, with patience, and
and with a little help from someone who understands what you're going through. Self-pleasure after 60 isn't just okay. It's wise. It's healing. It's human.
Conclusion: reclaiming pleasure, confidence, and self-respect. So here we are. If you stayed with me through this conversation, then I want to tell you something important. You're not alone. You're not broken, and you are absolutely not past your prime. You're in a new chapter, a different phase. Not worse, just wiser. Maybe no one ever talked to you about this. Maybe you carried shame, confusion, or fear for years, but you don't have to anymore. Today, you've learned how to let go of myths, how to treat your body with respect, how to adapt with tools, techniques, and mindset, and most importantly, how to reconnect with a part of yourself you may have thought was lost. This isn't just about sexual health. This is about self-respect, about dignity, confidence, and the quiet joy of still feeling alive in your own skin. I want you to hear this from me, as a doctor and as someone who has sat with hundreds of men just like you. Pleasure is not a luxury. Connection is not shameful. Touch is not a young man's game. It belongs to you too. So if this video gave you clarity, comfort, or maybe just the courage to see yourself differently, I'm glad. That means it did what it was meant to do. And if you know another man, friend, brother, even your father, who's quietly struggling with these same questions, share this with him. He may need it more than you think. If you're new here, hit the subscribe button. I've got more to share, more truths, more tools, more healing conversations we should have been having decades ago. Because your story isn't over. You're not fading, you're evolving. And there's still so much life, and yes, so much pleasure waiting for you. I'll see you in the next one. Take care of yourself. You deserve it.